Well, this is a grant that is going to run for 5 years, and I'm looking into asthma, specifically acute attacks of asthma. People have stable asthma and they cope with it fine normally with medication, but they have acute attacks which take them into hospital. I am trying to work out what goes on with the idea of trying to develop new treatments to prevent or treat these acute attacks. Patients hate having acute attacks. If you ask someone with asthma what they'd like their treatment to do, top of the list is always they want the cure so it goes away. But when they realise that's probably not going to happen, they want the acute attacks prevented, because that's what can kill them. And obviously in the majority of cases, thankfully it doesn't, but it's extremely distressing for them. Nobody hates anything more than coming into hospital. So the treatments we have available at the moment do not prevent the majority of attacks, and the treatments we have when they occur are very poorly effective. So it's a big unmet medical need. I'm hoping that we'll discover novel mechanisms that lead to acute attacks. We know that common virus infections precipitate most of them. A healthy person, when they get a common cold virus, gets a common cold, maybe a sore throat, maybe a bit of cough, but really nothing goes on in the chest. So the normal healthy chest is resistant to these common cold viruses. Someone with asthma can end up in hospital. So there's got to be some way that a person with asthma handles the virus infection, which is very different from a healthy person. We're going to infect healthy volunteers, people with asthma, study the lower airway during the infections, and hope that we discover differences in the way the infections are handled, and that those differences will lead us to develop in the longer term new approaches to treatment. We've already done some work similar to this, and we've found people with asthma are deficient in interferon production, for example. So interferons are now being developed as a potential new therapy. They may or may not prove to be effective, and we're hoping that we will provide alternative avenues for other, perhaps better or complementary therapies in the future.